Governor Ricketts is still stressing the importance of staying home to flatten the curve. Reporter John Kipper was in Lincoln today where the governor gave his thoughts on the conservative senator's proposal.
Monday morning, two state senators penned an op-ed in a newspaper saying the cure is worse than the disease and that they want restrictions loosened and the state to open back up. In response, Governor Ricketts said that while he would love to open up businesses statewide, he's very worried that the healthcare system would be overwhelmed.
The opinion piece from Steve Howren and Steve Erdman, two conservative state senators from central and western Nebraska, wants to continue to isolate the vulnerable while allowing the rest of Nebraska's population to get the virus. They hope after 4 weeks, around 80% of the state would have what's called herd immunity.
Herd immunity is not a plan, right? That is something that happens over time, and it's just the question is how quickly does it happen? If it happens too quickly, you're going to overwhelm your healthcare system.
Governor Ricketts points to Grand Island, saying hospitalizations occurred a week or two after they saw a spike in positive tests.
So there's a lag effect there from that happening. So we saw the high test for positivity, and now we're starting to see the hospital getting more patients.
By the end of the month, the governor will be making decisions on opening back up the state's restaurants and bars. He says he will likely get some guidance from the Trump administration, something they had before the restrictions were put into place.
I do expect to get that kind of guidance just because they've given it in the past, not because they've told me specifically they're going to.
Now, I also asked whether people that test positive for coronavirus are later tested to make sure that they don't have the virus. Governor Ricketts said that they are presumed negative after a few weeks of self-isolating. Dr. Gary Antone, the chief medical officer in the state, says that a few patients that are hospitalized are retested before they can return to a nursing facility to make sure that they don't infect that facility. Reporting in Lincoln, John Kipper, 3 News Now.